Indian healthcare has made significant progress, and from about 37 years lifespan at independence, our lifespan currently is 66 years. Despite this, Indian healthcare is amongst the most challenged systems in the world today. The Indian government's investment in healthcare is amongst the lowest in the world today. Additionally, healthcare insurance covers a very small part of our population. Together, this results in very high levels of out-of-pocket healthcare expense. In a poor country like India, this can cause huge problems, including high levels of indebtedness and low affordability. Lack of access leads to delays in credible and low-cost diagnosis for most patients. Fortunately, Indian entrepreneurs, whether they be with startups or multinationals, are making steady inroad into these challenges. By combining widespread availability of internet, modern medical technology, and innovative business models, they are coming out with very good solutions that help in easy availability of diagnostic solutions across the country at low cost. Cardiovascular disease is a leading cause of death in India, and easy access to diagnostic facilities will literally make a difference between life and death for millions of people in India.
In my 15 years as a cardiologist, the one fact that continues to bother me is that every year 7.2 million lives are lost due to a heart attack. In India alone, 1.5 to 3 million lives are lost. 50% of these lives can be saved if a heart attack can be diagnosed within 90 minutes and treated. How do we save 1 million lives? And that is why we started Tricog. Treating heart attacks is a solved problem. In India and most parts of Asia, we have figured out a way to treat heart attacks safely and in a very cost-effective manner. The treatment costs less than 1,000 rupees, and in most rural places as well, it is given free of cost by the government. However, the problem is diagnosing heart attacks. The symptoms of heart disease or a heart attack is exactly the same as acidity. And how do you differentiate both of them? You take an ECG. 79% of clinics across India do not own an ECG device. That is because the cost of the device is not factored, and second, the expertise to interpret an ECG is hard to find. The Tricog solution contains two important parts. First, we took a GE ECG machine, a Max 600 device that was built in India for India. It is rugged and it works on battery, can work anywhere for at least 5 to 6 hours continuously. We built a little device called the Tricog communicator that captures the ECG from this device, transmits in the cloud where the second part takes over. Some of our core IP is in our algorithms that work along with our medical team, and 20 specialists work 24/7 along with our algorithms to interpret the ECG that comes in, provide a diagnosis that goes back to the remote clinic all within a couple of minutes. So wherever you are in India, urban or rural, as long as there is a cellular connectivity, Tricog can offer you a diagnosis. If you have a heart attack, we can start treating you there. And more importantly, coordinate your care to a higher center. We address two important customer segments. The first are hospitals that have cath labs or tertiary care centers. And we set up a hub-and-spoke model for these centers so that they can not only identify patients with heart attacks quickly, but coordinate their care rapidly. The second segment that we address are those clinics, hospitals, nursing homes, and diagnostic centers where we provide accurate diagnosis 24/7, enabling these doctors to treat their patients better. Over the last year of service, Tricog is now at close to 600 clinics, hospitals, and nursing homes across India. We are in 140 urban and rural locations. And over the last year, Tricog has touched the lives of 250,000 patients.
The Indian arm of Medtronic PLC, a global leader in medical technology, has developed an innovative solution. Utilizing smartphone technology, they have enabled community health workers to diagnose a bulk of ear infections, thus increasing access and reducing costs dramatically.
In India, close to 63 million people have hearing loss and diminished hearing. And the main problems that were identified in that space are because of lack of awareness and access to the point of care. Shruti program takes the care into the community doorstep through the product of IntraView that has been designed, which enables a community health worker to do the screening of the patients at their doorstep. So what I meant by taking the care into the patient doorstep is that we take this endoscope based on the smartphone, which can be used by a community health worker to record and examine a patient's ear, actually record images on the smartphone screen, combine all of that information into a case, and then use the 3G network to push that case onto a cloud server where the ENT doctor can examine that case in his office. The key USP of the Shruti program is that it's a unique program which serves the dual purpose of having a social impact by providing care at subsidized cost to the patients, while at the same time being commercially viable for the doctors as they're able to see many more patients and also do many more surgeries than they would have otherwise been able to do.
जैसे हम चेक करने के लिए जाते हैं पेशेंट को, तो कई तो मना भी करते हैं, पर उनको हम फॉलो करते हैं, फिर अच्छे से चेक कराते हैं, फिर उनकी पिक लेते हैं, फिर उनको खुद से दिखाते हैं कि आप देखो अपने कान में क्या प्रॉब्लम है, क्या है, तो उनको अच्छा भी लगता है। फिर वो जैसे हम उनको स्लिप देते हैं, वो दिखाने जाते हैं हॉस्पिटल में, कि उनको पता भी चलता है कि हमारे कान में ये प्रॉब्लम हो सकती है।
Technology is the other central driving force behind the whole Shruti program, be it through our patient management platform, which is able to channel patients to the doctor and ensure that they receive care, or the fact that our device is not dependent on data connectivity, so we can do cases in remote areas, and as and when we get network connectivity, it pushes those cases onto our server.